All right, let's get going. Thank you so much for attending. A little bit about our center. Wanzi and I are from the Center for the Study of Childcare Employment. We were founded in 1999, and we conduct research and analysis on the preparation, working conditions, and compensation of the early care and education workforce. We are focused on policy solutions, not just research. And we strive for a vision of an effective public early care and education system that secures racial, gender, and economic justice for the women whose labor is the linchpin of stable quality services. I will briefly pause to introduce my colleague Wanzi, but first, my name is Anna Powell. Wanzi, say hello.
Hello, my name is Wanzi Muruvi. I'll be with you with Anna.
Wonderful. And as we are going to be looking at a lot of data today, I just want to give some opening thoughts to ground our conversation, just to expand a bit upon what I was just saying about our focus. So first, early care and education is a public good. And how do we see that show up? First, we know that children experience leaps and bounds of growth by participating in early care and education. We also see that parents are able to maintain steady jobs and a stable income. And also, we see that early educators see their positive impact every day in contributing to this public good. But as many of the folks on this call are well aware, the United States does not fund early care and education like a public good. And similarly, neither does California. Next grounding thought. Important to remember that childcare work is skilled labor. By that, we mean we hear all the time from early educators, we are not just babysitters, we are professionals. I have a degree, I have 10 years of experience, and they're doing highly complex tasks and activities every day in caring and educating children. But we also know that the field offers some of the lowest wages in the country. And so there's just not enough people entering or staying in the profession. A third and final grounding thought to think about is what's going on here? Well, we have a market failure. So it is the case that parents struggle to afford the childcare prices. But meanwhile, the providers are earning basement wages. So both sides of this group are experiencing hardship to their well-being. And then in terms of the programs where early educators work, we know that childcare businesses have razor thin margins, but they can't afford to raise prices to improve those wages since, as we just said, parents are struggling to afford the price that's there now. So as a consequence, that early educator pay remains structurally low. And here in California, as of 2025, the public funding that comes into the system does not cover the true cost of care. It, first of all, doesn't cover everybody who needs it, but even for those people who can access that public funding, that funding can't cover its true cost right now. So these are some contextual factors to bear in mind. So today's agenda, we will be first sharing data, or I will be sharing data on the trends in early care and education staffing and enrollment that we gathered through our studies. Then we're excited to have a panel discussion with ECE program leaders from across the state. And then at the end, we'll provide a few resources for advocacy and policy work to take away from today. A little bit of background about the data. The California ECE workforce study includes surveys that were conducted across the state from 2020 through 2024. And these cover both childcare centers and family childcare homes. So the two primary licensed care settings where birth to 5 is taking place. Prior to 2020, the last time there was a detailed statewide data was in our 2004 to 2006 data, which some of the folks on this call may remember well. And this survey that we've conducted multiple times, it does cover site level information as well as person level. But in this webinar today, we are going to focus on the site. And by that, I mean the information such as staffing and enrollment. But you will see us dip into these person level questions, for example, the aspirations and interests of individual educators. And I see, by the way, a question that will these slides be available? Yes, we plan to. We are first of all recording this session, and we will make the slides and the recording available to attendees. Also, I realized I forgot to mention we have a Q&A box. Feel free to enter any questions there, and I will be sure to look at them before we move off of the data slides. All right, let's start with our family child care profile. And with this, I'm going to give a quick summary, then we're going to look at some charts. So first, on the enrollment front, SCC educators have small group size, and as a consequence, they have not changed much on average. But we do find evidence of a shift among the large FCC educators. Specifically, the average enrollment for the 4 to 5-year-olds has decreased from about 4 children on average to 3 children. And we're seeing something similar with the 3-year-olds. So the preschool age group, we are seeing the numbers of that age group decline a little bit. And related to that, we do have comments from FCC educators who really feel the loss of this age group, especially age 4 to their enrollment, deeply, even if it's just a difference of 1 or 2 children. Because it not only impacts their revenue potentially, but it also impacts their interactions with the other children. For example, having more younger children in their program. And on staffing, we know that large SCC providers frequently work with an assistant, but the share with a paid assistant fell from 58% in 2020 to 43% in 2024. And at the time of our last survey in 2024, 1 in 5 FCC educators had a vacant assistant position. All right, time for the charts I promised. So I want to orient you. In the rows, we're showing you different points in time. So the first row is what educators reported was their enrollment before the pandemic. So like at the start of 2020. And then we have the height of shelter in place, late 2020, and then these follow-on surveys in 2023 and 2024. And I do want to make sure you notice these N in parentheses. That means the number of people who participated in the survey. So in 2020, we were able to reach a large group of folks, over 2,000. But since we were only doing follow-up in the later years, we reached a smaller group. So just bear that in mind. Of course, for each of these numbers, we try to use statistics to adjust and balance the number so it reflects with weights the distribution of programs in that given year. But if that's just jargon, you can forget I said that, and let's just look at what we're seeing here. So as I mentioned on the summary slide, the overall numbers, they moved around a bit, but they're largely close to where they were. But it is the case that in the large FC educator, we do see a decline about 1 enrollment. Now, of course, when you're seeing that there were 7 folks in a small SCC program, or rather 7 children being served, I want to stress that these are total enrollments. Not all these children were necessarily there at the same time. This is the total number of children being served. And here we have a few quotes focusing in on the decrease among those 4-year-olds. So one educator from Humboldt County wrote, "The 4-year-olds were the big kids in my program, capable of modeling good behavior and self-help skills. They helped in walking to the park and being safe buddies, just like in a large family. I don't feel we can do that without more help. Too many young kiddos for field trips." Then a San Diego County educator said, "We now have the responsibility of transportation to the TK program because parents work non-traditional hours. I have to hire someone to cover me since leaving my assistant with the children would put me out of ratio." So these quotes, we feel, help to tell the story of what is going on within the program, even if we're in the FCC context, talking about slight shifts in the numbers or in the ages. It's that in the small mixed age group, those changes can be felt very deeply, especially among educators who are really accustomed to having some of those 4 and 5-year-olds in their program. Now, briefly on staffing for FCC educators. I'm focusing on the large license holders who may serve 12 to 14 children because they are more often needing an assistant. So once again, the rows are showing different points in time. And you can see in this first column, the share with no assistance, it really jumped up in late 2020 at the height of shelter in place, where many large FCC providers had no assistance due to the pandemic. But while that has dropped back down, this paid only column is where we see a bit of a drop from 58% that did have a paid assistant and that was their only support to now only 43%. So this can be bright evidence of slight shift, but also, as we know, 1 in 5 FCC educators report a vacancy. So there's some indications that while it's always been challenging to staff, folks are definitely feeling that with their assistants currently. But let's talk a little bit about some quotes. So, what do we hear when educators were given an open-ended question? Well, the first person from Sacramento County, they do feel that this particular moment could be impacted by TK. This person said TK programs are able to offer assistants top dollar. Obviously, assistants aren't rushing to home-based programs paying minimum wage. But we do see other folks who maybe don't see it that way. A Kern County educator said, staffing is a mess since COVID, and I can't say it relates to TK. The fast food wage of $20 an hour is affecting my staffing. So obviously, this is a complicated moment. We are coming out of COVID. The ground is shifting with TK, but also there is a historical challenge of staffing and turnover. So there are many things happening at once, but many folks are feeling impacts of change. Thank you for any questions you may be putting in the Q&A. I'll be sure to look at them after I do this next bit. But let's now talk about childcare centers and a program profile. So high-level summary, enrollment did fall in all the age groups during the pandemic and only partially rebounded by spring 2024. And the greatest impact we're seeing is in the Head Start Title V, and this is right, including state preschool. That's where the greatest impact is. And especially, as you'll see, we have a big decline of about 20 fewer children aged 4 to 5 in 2024 compared to pre-pandemic, so start of 2020. And directors, we asked them what their strategies would be to address this if this trend continues, and they largely agree that increasing enrollment for 3-year-olds is the best strategy. But we also know that many center teachers, while they're open to that, not as many are interested in teaching infants and toddlers. So going younger than 3 may be something that is not as directly available. And meanwhile, on the subject of turnover, directors and teaching staff agree that economic concerns like educator pay and cost of living are the top drivers. And we do estimate a 24% turnover of lead teachers and 32% of assistants just in the time from 2023 to 2024. So to give a current snapshot of what programs are seeing. On to the slides. So here I'm showing you these different points in time, the average enrollment by age group. Of course, we know that they mentioned age group enrollment across the board is down. But in the case of infant toddlers, it's been recovered closer to what it was. So average was 22 of that age group in a site in the start of 2020 and now 17. So a little bit lower, but not quite as drastic as the 4 to 5 and for that matter, age 3, where we see this decline. So while we know directors looking ahead see increasing enrollment of age 3 as an important strategy, we don't see that they've already been successful at making that shift. So whether that means working within a classroom that was already mixed age to enroll more 3, or retooling classrooms that were for 4 and 5-year-olds to age 3. So right now, it's just the case that enrollment is down. And as I mentioned, here we have the specifics that 67% of directors do see that it might be necessary to increase enrollment for age 3 to be the best response to this moment. And 25% of directors could be they selected both, but 25% would see that increasing enrollment for infants and toddlers is a good strategy. So they're not as inclined to go in that direction per se. And just to illustrate the impact for the Head Start Title V, also state preschool environment, if you look at the top half of this graph, we're looking at pre-pandemic just to last year. We see in particular this big drop among age 4 and 5 in the Head Start Title V environment. So about 20 children when we compare the two averages. Here are some quotes from the directors about what we're seeing. The first one from Sonoma County points out, sometimes we just feel as though the rug has been pulled out from under us. After the pandemic, We were never able to reopen the third classroom. Soon we won't start the year with any 4-year-olds. But we've had a rich pre-K curriculum for 30 years. Our teachers have had to adapt the curriculum for younger children. So there's some transition that's going on with the staff, but it's not necessarily a smooth one. And then another director, this one from Monterey County, says Montessori depends on a balanced mixed age classroom of 3 to 5-year-olds to help make the most of the curriculum. If more families choose TK, it will be a detriment to our program and diminish the quality of instruction. So once again, pointing out that within the program, within the classroom, these changes can be felt in ways other than just by a change to the average enrollment. All right, a few points about staffing, and then we'll be wrapping up the data from today. So here I'm showing you what our directors reported at their site, right, comparing 23 and 24. And I had said at the beginning of this section that we had the 24% turnover of lead teachers and 32% of assistants. But how often is this happening at the site level? Well, it's happening at most sites, right? 75% of centers are having at least one person come and go in this time period. But on average, it's actually closer to 3 lead teachers and 2.5 positions of assistant. So these are pretty high numbers. And I do want to point out that it's slightly different between the Head Start Title V and Title 22 setting. Title 22, for those of you who are not familiar, is just the kind of standard health and safety. So this would be everybody who's not part of one of these special programs, such as Head Start. And we do see that 49% of directors are reporting at least one vacancy. So it's not just that they had the turnover, they addressed it. We know that folks have vacancies now, about half. And to cap off this section, here are some quotes from the directors. From Santa Clara County, one person wrote, "Not all the teachers want to work with the younger age group we are enrolling." And then another person, this one from LA County, wrote, "I worry that a lot of community-based child care centers will become staffed by young, inexperienced teachers or undereducated teachers as more and more ECE professionals move to the public TK system." So this is looking forward a bit, right? It's a bit about the moment we are already in, where staffing is a challenge, and also staffing people with really high quality qualifications. That's always been a challenge. But could this become exacerbated as more jobs become available in TK? Directors are worrying about this on the horizon. So I'm pleased to share that data. Before we get into the panel, I'm going to take a brief look at the question and answer. When asking center directors about the best strategy to increase enrollment, was that asked in the context of having the current system and policies in place? Or did it ask them what they thought the best strategy would be if they could change anything? Great question. So we asked them if the current trends continue and children are given the option increasingly of enrolling in TK as they become eligible, and also the existing infrastructure that is there to support programs is the same. So we didn't ask them if you could change all the policies, how would it go? We asked them, what do you think is coming for you as this continues? Do you have pricing data for these providers? Great question. We didn't gather that in these surveys, but I am pleased to tell you we will be doing a new statewide survey later this year, and we're going to ask about whether folks have raised their prices. But there is other reports out there on pricing, which can be beneficial. Next question for the staff not interested in teaching younger students. Are those interested in entering the TK-12 system? Great question. So we did see amongst center teachers who currently work with 4 and 5-year-olds, they were about equally interested in teaching age 3 as following those children to TK. So I would say that those are pretty dually powerful aspirations that teachers are weighing. But there's what people think they're interested in, and then there's what's possible to them. So those may be two different things. So I have one person who said, my interpretation of the first graph is that there's no decrease in overall enrollment, but then breaking it out by infant, 3-year-old, 4 and 5-year-old, there's decrease in all age groups. So Nick, I think maybe I will follow up with you. I want to make sure I'm looking at the slides that you're looking at. And then finally, did you compare the year-over-year staff loss to prior survey data over the rates? This is a great question. So we can estimate turnover in previous years, and we didn't do that particular analysis in this fact sheet, but I think it's a worthwhile question. In 2021, we published a report on the turnover estimates that took place in the course of 2020. And as you can expect, we found much, much higher rates of turnover, especially because programs sometimes had to flip and cut down their program. They lost enrollments overnight. And so there were then jobs that were lost in the process. So compared to what happened in 2020, this is lower, but we didn't do a tracking turnover rates over time in here. Questions about hold harmless, that's a great question. We did not cover that specifically here. Comparing to other states, also a great question. And then why are early educators leaving the field? We have some other releases that I can try to link to. So I'm going to pause there. Thank you for those questions. I'm going to now pass it to my colleague Wanzi to start on the panel, but please do keep entering your questions and I'll try to write responses in them as we go forward.
Thank you, Anna. I will stop sharing my slides. And before I move on to the panel, I just wanted to answer one question about the slides and the recordings. We will be able to share the recordings and the slides with people on the webinar. Thank you so much. I now want to welcome our panelists. We have Janet. You can probably, come on camera. We have Drew and we have Benu. And we have like really tight time, but most of our time is gonna be spent in the discussion here. And first, I'm gonna invite our panelists to briefly introduce themselves. Introduce yourself by telling us your role in early care and education and the type of program that you operate. I'll start with Benu. Can you please introduce yourself in a minute? You can unmute yourself, Benu. Okay.
Good afternoon, everyone. My name is Benu Chhabra. I am a large licensed family childcare educator here in Concord, Contra Costa County, and I'm so glad to be here. I'm also a president of Bay Area Professional Family Childcare Network. Thank you.
Thank you very much, Benu. Janet, can you go ahead and introduce yourself?
Okay, hi, I'm Janet McDonald. I have been in the field many, many years, working the last 26 years with Family Service Association. We're a nonprofit social service agency. I'm the program administrator for the child development. We operate 10 state-funded child development program for children ages 3 months to 5 years.
Thank you very much, Janet. And lastly, Drew.
Thank you, Wanzi, and good afternoon, everybody. Drew Furedi, President and CEO of Panelist Niños here in Los Angeles. And in addition to operating 7 Head Start and early Head Start centers, we also operate several charter schools. So know a little bit of the TK side of this as well, and just happy to be here.
Okay, thank you very much. And now I want us to briefly reflect on the data that was just presented. I'm going to ask this question and will take turns, each one of you are responding. What resonated with you and your own experiences from the data that was presented? And are there any specific findings that are reflected, that reflected your own experiences? I will start with Drew.
I think the easy answer would be all of it resonated. Thank you, Wanzi, for the question. I think I come to this table thinking really about the data pieces and our own experience on staffing challenges as it relates to enrollment. Because with the staffing challenges, as everybody knows, that does impact our ability to even keep enrolling. And for us, we really are seeing that tension in our infant and toddler classrooms. So, but all of it resonated. I'm really glad that you're lifting this up.
Thank you very much, Drew. I will move on to Benu. Benu, can you tell us from the data that was presented, what resonated with you and your own experiences?
I will agree with Mr. Drew as well. Even though we are, as the licensed family childcare educators are also going through the same things, same struggles, same challenges. That the expenses of the childcare programs are high, and most licensed family childcare educators do not make minimum wages for the 10 to 18 hours we work each day. Even though many providers have degrees and or certificates in child development. So, for example, myself, this is my first year in 25 years that I have a low enrollment. I always had a waiting list. Before that, I was having hard time finding employees. And, now I have employees, but my enrollment is down. So I'm in the same shoe as well. Thank you.
Thank you very much, Benu. And finally, Janet, what resonated with you from the data?
I concur with my colleagues here, all of it. But staff and enrollment lost after the pandemic definitely aligns with what we've experienced. We've recovered largely with our enrollments, but we're continuing to struggle with the staffing. So maybe the opposite of Benu. We have struggled and watched as TK has continually expanded and many of our students and families left for the school districts. So not only is there the lost enrollment, but we as educators and caregivers that we've had concerns that the programs weren't maybe as developmentally appropriate as they need to be as they're just beginning this process. Maybe they're not focused on the families in the ways that we are. So we're worried for the children. And also, some of our staff have moved on to the school districts with that preschool TK age, lured by the higher wages and the better benefits that we can offer.
Thank you very much for those reflections. And now we want to move into a little bit more deeper look into how the landscape is shaping up. So we know that the childcare sector has and is still experiencing many changes. The pandemic nearly brought the sector to the brink. And although federal pandemic funding provided much needed relief, the effects still linger. Meanwhile, in 2021, California began expanding the Transitional Kindergarten program so that by 2025-26 school year, all 4-year-olds will be eligible to attend 1 year of school before they start kindergarten. Now, our panelists are going to help us understand how programs are faring in the middle of all these changes. So I'm going to ask questions again, going through our panelists one at a time. So I'll start with Janet. How has Family Service Association fared with hiring, especially for younger children like infants and toddlers? Plus, California State Preschool now allows some 2-year-olds to enroll. How has this change played out in your programs? For this, you have a little more time, 5 minutes to share with us.
Okay, thank you, Wanzi. So definitely, hiring is challenging, probably the same for everybody. Shifting to the younger children means that we need more educators to meet those ratios. And we need people that are passionate for the infants and toddlers, like it's been kind of references that a lot of our preschool people they're used to that age group, and shifting to younger is challenging. So, and I would say that most of the educators we come in contact with are interested in the preschool age group. So we've tried to focus on providing internal supports for the educators here, providing enhanced classroom materials. We're trying to staff above the required ratios to make their environments less stressful. We're getting ready to hire an infant toddler instructional specialist, so to provide further support for them. These measures, they help to support that we're a quality program, so that's attracting to the candidates. We're a good place to work. So that's what we're kind of pinning ourselves on, trying to work that angle. Beyond doing what we can with competitive pay and benefits, we had to get creative to attract candidates. And so we use social media, showing our fun environments and all the wonderful things that, that we do. We have a recruiter to be in the community to kind of help get our name out there and what we offer. And we are considering increasing the pay for our infant toddler people over the preschool people, just acknowledging the additional, specialized knowledge and support that they provide. We really need the state to understand and support that the higher costs serving younger children with the higher staffing needs. So as far as the enrolling 2-year-olds, I do feel that we have an advantage to a lot of programs because the ones that are geared only with preschool, because we already have infants and toddlers in our programs, we know how to do that age group. But how we've operated this, we have added 2-year-olds into our preschool programs. We've done it selectively. We've added some 2-year-olds into preschool classrooms, either by having the classrooms be mostly the same age group, so it's a 2-year-old classroom, or by individually, what children are developmentally ready for and placing them that way. So while the state I just want to call attention to, while the state may call these children preschoolers, they really still are they're toddlers. And so they have higher needs. And there's more potty training, more emotional support for the education, the educators to help develop those skills. An added factor that highly impacts us is the expectation of the state for state-funded programs to serve a certain percentage of children with special needs. So part of the issue there is that the state, in my opinion, that the state has a very narrow focus of what meets that criteria, and that's an IEP. But we're experiencing a lot of children that have these needs, maybe even autistic children with a variety of needs, but they have diagnoses from their doctors. They do not have the IEP, so they do not meet that criteria. Of course, we're serving them, we're welcoming them into our environments, but we're still tasked with meeting that percentage of the special needs. So they need more support. We need a better ratio. They need training. The workshops, they help, but they're not making enough of an impact. We're having educators that are overwhelmed. So some of what we're doing is we're hiring preschool instructional specialists, we're purchasing special equipment and materials when we can identify, what will help. The directors are busy daily helping support a staff that, they are overwhelmed. We could use financial support from the state, recognizing all of these aspects. We need specialized training that, all of this could go a long way to support our educators who are putting their heart and soul into these children and the families.
Thank you very much, Janet. You raised up really important points around resource needs, whether it is about supporting the staff that is caring for infant and toddlers, as well as in the enrollment of 2-year-olds into the state preschool. So I really appreciate that. Let's move on to Benu. What can you tell us about enrollment levels in your family childcare program? How does that impact you? And what are you hearing from your fellow family childcare educators as president of the Bay Area Professional Family Childcare Network? Benu, you can unmute yourself.
Thank you so much. I would like to, I remember Anna posted, when she was sharing a slide about skilled labor. So family childcare is a skilled labor educators. They hold degrees, meet licensing requirements, and provide critical early learning. It's time that their work is valued and compensated. So right now, like I mentioned earlier about, with me having a staff, but then I know many of our members, I speak to many educators every day, and we're still struggling, even though I have employees. But that we cannot compete with the restaurant, $20 to $21 an hour, right? So there is a lot of increased pressures with fewer children's. Family childcare educators are feeling the pressures of, to to lower the fees. And as like we know that the childcare is the second largest bill on the parents. And we cannot ask them more than what we get from subsidized care. So low enrollment also limits the ability to invest in, the quality materials, trainings, or updates to the environment that are essential for providing the best care and education. So when the grants were given, we were able to, use some of that funding to do repairs and, get the things that we needed. So also, I always I'm talking about the staffing challenges, so there are providers, they may not be able to hire additional, help or maintain, current staffing levels due to the financial constraint caused by the low enrollment. Now I do have a low enrollment, but I didn't want to lose my staff because I'm, still thinking, because I'm going to need them, right? So this also, can do a burnout on the provider by, having all these, challenges and stuff. Low enrollment is the one topic that everybody's talking about right now in our groups. And that leads to fewer available childcare slots in our community, which is reducing options for the parents looking for care for their children. That's making it harder for working families to find reliable childcare because of the cost. And also, even though, we play a critical role in early care and education, funding for family childcare hasn't caught up with our needs. Subsidy reimbursement rates don't reflect the true cost of care, and policies often favor large centers, over family childcare models. And we need to I always say we need to advocate. Like yesterday was a family advocacy day. We were there, our group, California Family Childcare Network, we were there advocating. We were, I don't know about everyone, but we were really advocating for the families and ourselves of the 80-20 rule. So with that, we are not able to leave our program. And, many of the family childcare educators can't even get to the doctor's appointment because you are not allowed to leave your program. You have to be present 80% of the time. So it's kind of like we're playing critical role, and then, we're just not taken care of. So we need to really, I feel like, we need to really advocate for higher reimbursement rates for subsidized care that accurately reflect the cost of providing high quality, personalized care in small setting groups like ours, family childcare homes. Many family childcare educators also lack the resources to market themselves to the families. We need systems in place to connect with family childcares, with families looking for personalized care in the families, in our communities. So, I think these are very, very important. We really, our voices need to be heard. And many of the families, for example, in my family childcare home, the families we take care of, they don't even have extended families. So we're the one, who go above and beyond. And I know many of the family childcare educators stay open almost 24 hours a day and providing that, the childcare that's, the quality cares that's needed. We also been, doing all these ASQ, DRDPs, everything, from the beginning. Many of us in our group have taken all the workshops, all the, the professional development, all the classes, I mentioned earlier about the degrees that we hold. So, with the TK coming in, it has taken, those younger kids from our programs, and it's putting us in a spot where, we're having a lot of hard times, dealing with all these things, and which is, we know that the brain development happens in those early ages, and who's taking care of those children? We're the only people who stayed open during pandemic. Thank you.
Thank you very much, Benu, for highlighting how the math is not mathing to address lower enrollment by reducing parent fees. You know, it's a math that's not mathing, and I really appreciate that. And then the focus on ability to support family childcare providers to be able to market themselves so that at least maybe that could improve their enrollment. I'll move on to Drew. Drew, how has Panelist Niños been approaching wages and benefits to try to stay competitive? And how are you faring when it comes to being fully enrolled, like we have been hearing?
Thank you, Wanzi, and thank you, Janet and Benu, for raising such things that I'm going to hope to build on here. So I'm going to start like sort of on a policy side, and then go to a conversation I had recently with one of our one of our teachers in one of our centers. But and Benu, you mentioned this as well in terms of when you think about the workforce in California, and we have well-meaning and good intention policy that's around something like fast food wages rising, or we just look around and see big box retailers are paying more than we can provide with the money provided. It does a couple things. One, it has real life implications on a day-to-day basis in terms of our ability to really make a good case and make a good proposition for why people would work with us. It also sends a signal about what we value as a society, right? And it's not that we shouldn't value people that work in those other industries, but if we're not also lifting up the need and the value of what a colleague talks to me and says, always talks about, childcare educators are brain architects, right? They work with parents to be the brain architects. And if we're not valuing that in that same way, there's something missing there. So how are we, our approach is, you know, we did a salary study. We do, oftentimes we're just checking where we are in the world, and we absolutely have to check that even more now because of the allure of going to a district setting or a K-12 setting or a TK-12 setting where there is a state retirement system, where people are able to just be treated in a different level of professionalism by those around them and those in the system and setting policy around the system. We do what we can to bring additional dollars in fundraising, and it doesn't get to where we need to get. I think anybody who's listening on this call and participating on this, and my colleagues Janet and Benu would agree, this is work of the heart, but work of the heart doesn't pay the rent. And when we're living in situations where it's impossible or very, very challenging to live closer to, for us, Los Angeles, where our centers are, it creates this additional piece of how long can we actually keep people. So I shared this with a few of you before, but recently I had a conversation with one of our educators and said, "Why are you still here? Explain to me what is it that's keeping you here? Because I know we're not paying you enough. We have a retirement plan, but we don't pay into it yet because we're not able to as an organization. What keeps you here?" And she said, "I love this work. I'm aligned with the mission. This is what I want to do." But then she said to me, "There will be a point at which I can't do this anymore. I can't live close to where I work. I can't make it work. Right now, our family is able to make it work, but there will come a time when I'm going to need to look at other options." And that just, obviously that fills us with dread, and we think about, well, what are the other things we can do? So we try to work to make coaching a real thing, to make professional development, to really try to do our part to professionalize it, so people feel like they're getting, yes, they might not be getting as much as if they worked in another setting, in terms of a wage, but they're getting other additional benefits from being part of the team with us. And enrollment's piece is I'm really happy that we only have, this sounds crazy, but only have a handful of openings in vacancies in our centers. But that impacts whether we can open classrooms, and everybody knows this, right? So we have a couple classrooms that are dark and have been dark for a while because it's not because there aren't people who want to put their children with us for the day. It is because we cannot make the ratio on some of in some of our centers. So I went over my 5 minutes, but let me pass it to you, Wanzi.
That's okay, Drew. Thank you so much for highlighting all that. I mean, staffing. It is about how much we can have the educators in the room to be able to have the children in the room as well. And I will move on to our last question. This one will just be a minute for each one of you, and it goes to all three of our panelists. What support or resources would make the biggest difference for your program as you adapt to the changing landscape of childcare? I will start with Janet.
Okay, thank you. I'll try and be quick. And I think the answer is clear. It's financial support to be able to pay, pay rates and benefits, to be able to have educators that are able to support their families and live their lives while working in this industry that they love. Definitely. Maybe specialized positions to support, the niche things that we're having. But additionally to that, I just wanted to say a couple things really quick, is that, the impact of quality care on society is undeniable. There's been so many reports and studies on that it's cost beneficial to have good quality care, to have children be experienced to it. So one thing that I'm hoping is that I'm hoping that in the coming years that they're going to do studies on the TK environment and experience to ensure that, that there's benefit, that it's developmentally appropriate, that the experience is what they hoped it to be. Because nobody denies the bringing in children and exposing them to good care and quality education is a good thing. It is. We just want to make sure that that's the avenue that it should be. Thank you.
Thank you, Janet. Drew, last words. What supports and resources would make a difference for you?
I'll go quickly and say, agree with Janet. This is funding, this is benefits, this is wages, benefits, and some different way of thinking for us to just thinking about what are the pipelines that are set, not just by individual providers, but what are the pipelines that we can see developed statewide or regionally to produce more educators for the next generation. And we do it with we have youth workforce centers, part of our organization. We try to pipeline some of those youth into this profession, but we need to think about that systemically and systematically.
Thank you very much, Drew. And lastly, Benu, your thoughts?
I would say, providing grants for or subsidies for professional development and higher education would help family childcare educators stay competitive and increased enrollment by offering higher quality childcare. And I believe we should have a partnership with local governments, advocacy groups, and businesses to promote family childcare as a viable and valuable option for families. Thank you.
Thank you very much, Benu. I think Anna, we have a few minutes to open to questions in the Q&A or questions for the panelists.
Thank you all. That was really fantastic panel. There were a number of great questions. I didn't see any directed at specific panelists, so please, if you're listening, please go ahead and write those questions now. I did want to mention, so colleague Hannah Melnick shared a resource about whether California is serving more children in age 4 and 5. So there's some preliminary evidence there, and she shared a link to report. Thank you, Hannah. Mhm.
And while we're waiting for questions, Anna, did we go through all the ones that were asked of the data whilst we are waiting for questions from
Yes,
the panelists?
definitely. I entered a few responses and a few more came in during the panel. For example, there was a person who asked about whether community-based programs and both in homes and centers are entering into partnerships with, for example, school districts where TK is offered. And this is an area that could be quite interesting, but we don't yet know whether this is happening in large amounts across the state. There is the mixed delivery grants that have gone out for coordinating purposes, and it will be interesting to track over time whether this is feasible. I will say one issue that came up, as you heard, if you may remember one of the quotes, an FCC educator mentioned needing to do transportation. So let's say we are successful in seeing more partnerships. There's still the practicality of what it takes to help children engage in those different opportunities over the course of the day. So there's so much that we need to learn about what that would look like. But I think it's fair to say it is a big departure from the way that programs have been operating to be this sort of bonus hours or something like that. It's a very different business model to support aftercare than to support a program that operates during the day. So yes, there's likely potential, but it also may take a lot of learning and relearning. Did anyone of the panelists want to comment on a partnership that you know of or you're entering into?
And not necessarily a partnership, but just one thing I wanted to say about maybe another support that we could look for is definitely, I appreciate Benu's perspective, and those are really good environments for children. So the more funding needs to be shifted to there. But I think one thing I neglected to really highlight in the the transfer to more TK is that to enroll in a TK program is simple. It's like, it's easy peasy, and you are in a state funded program or a Head Start program. Oh, there's lots of things that hoops you have to jump through and get these, I need this from you and I need that from you, and and give me, and the families feel, they're overwhelmed with it. So possibly a support that we could benefit from would to be having to kind of maybe align the entrance into our program to how they enter into a TK program.
Thank you, Janet. Any comments from our panelists? Benu, I saw you unmuted yourself. Please go ahead.
I just wanted to say thank you, Ms. Janet. And also just, when you are around family childcare educators, just ask, like, if there's some of them are sitting at the table, few of us, ask how many years of experience. And if you collect all the data, just check it out. There's tons and tons of experience, years of experience, and that's what it counts. Thank you.
Wanzi, can I add on to
Yes, please.
brilliance
Go
of
ahead.
these two?
Yes.
So when I think about partnerships, what we've tried to do with some success is to reach out to people like chambers of commerce and other business oriented groups to make the case, and it doesn't take much to make the case, that the workforce challenge within the early learning world, whether it's center-based or home family-based, that's a region-wide workforce issue. Because if you, on a couple levels, right? If you can't, we know it, if you can't have somewhere to put your child that you feel safe with and is growing developmentally safe and all those things, then it impacts where you can work and how much you can work. And let's be, I think it was said earlier, but the explicitness of the most, whether it's family centers or center-based work, mostly women of color. And we need to lift that up everywhere we can, that this is a civil rights issue. This is an access, inclusion, diversity issue. I know those aren't popular words in some places these days, but that's what this is, and we should say that.
Thank you so much, Drew. I know we only have a couple of minutes or maybe even one, and Anna is gonna share with us the resources. I saw somebody had their hand up, but please type in a question in case we don't get to you.
Thank you, Wanzi. So in our last 60 seconds, I want to briefly mention two things. First, this is the California E4 Toolkit. It is a way that we've organized much of our data on different themes. For example, the main things to know about compensation, about work environments, all from here in California. And we're hopeful this can be useful for educators to advocate for themselves, but also for those of you who want to be supportive of that. We hope that this can help. So here's the QR code. Of course, when we share out the slides in the recording, you'll have access again. And then the second is we released in late 2024 the newest edition of the National ECE Workforce Index. This has data in it, state by state data, but also it has a kind of barometer on all of the access to policies that support the ECE workforce. So this is a great way to understand how does California compare to other states and what are the approaches that all states are taking, as well as what are the creative ways that federal funding were used, and what are policy recommendations that all states should do to support the workforce? Well, I just want to conclude by saying thank you for attending. Thank you so much to our panel for really sharing some on-the-ground truths, and we hope to stay in touch and have as good of a wonderful end of your week as you possibly can. Stay warm, stay safe if you're in Southern California, and we'll talk soon. Bye-bye.
Thank you, everybody. All right.